And one more thing, sir, if you could give us your name and your hometown. When you stand up and ask your question, then you go ahead and take a seat. Thanks.
Roger Klinsman, and his hometown is Dubuque. And first, I would commend the congressman because evidently he's read the bill. Many of your colleagues don't feel it's necessary. My question is, the president says that he can get $600 billion out of Medicare and Medicaid without cutting services. If that's true, there must be a lot of waste currently in Medicare and Medicaid.
That's true.
So if that's true, why would we want another wasteful government program, which is what this is? Why would we want to spend?
Well, it's interesting you bring that up because during the markup, one of my colleagues who's been getting a lot of press lately, Anthony Weiner from New York, offered an amendment. And this is what it says. Elimination of eligibility for Medicare. And he had these findings. Congress finds 1, Medicare is socialized medicine. 2, Medicare is a single-payer system. And then he moved to eliminate Medicare and put that up for a vote. And not a single person voted for it. Why? Because Medicare is one of the most widely popular government programs that's ever been passed. And you just have to ask people on Medicare, and that's what they'll tell you. It is still one of the most efficient ways we have of delivering health care. And there's a reason for that. Because right now, a lot of private insurance companies have loading fees which have nothing to do with providing health care, but they have to do with the administrative costs of running their company and profits. And all you have to do is look at the information from the health insurance industry, which has seen its profits go up 100% over the last 5 years. One of the 2 prime players in Iowa is United Healthcare, which bought John Deere Health Insurance. United Healthcare's CEO has total unexercised stock options of nearly $1 billion. He gets paid almost $13.2 million, and in 2009 has already exercised $127 million in stock options. Cigna's CEO has made $120 million the last 5 years. Aetna's CEO exercised stock options of $194 million. And over the past 5 years, the top 5 health insurance companies have averaged nearly $2 billion in profit. So one of the reasons why we have to improve Medicare is because Medicare, with all its flaws, is still much more efficient in delivering health care than these private health insurance companies are. So by creating competition in the marketplace, we should do 2 things. We should make Medicare and other government programs like the VA healthcare system, which most medical economists rate one of the most efficient delivery systems in healthcare, and TRICARE, which takes care of our military personnel. All of those are preserved under this bill, and by creating competition for other folks, we should help improve the way we deliver health care. And that's why I have been adamant, and I took on the chairman of the House Ways and Means Committee, the chairman of the Energy and Commerce Committee, and the Education and Labor Committee, all of whom are from New York and California. And I was in a room for 5 hours negotiating this regional disparities agreement because it's wrong. It's wrong that the rest of the country is being denied high-quality, low-cost health care. And I am committed to doing everything I can to improve how Medicare functions and restoring its financial stability.